There are various markers that give an indication of an increased risk for the development of diseases of lifestyle, such as diabetes and heart disease. These indicators include certain susceptible individuals, traditional risk indicators, and emerging indicators of risk. Does your father, mother, or maybe a brother or sister have type 2 diabetes? If so, you have a very big chance of developing diabetes at an even younger age than they did. Diabetes clusters and runs very strongly in families. The destructive metabolic cycle, with its inflammation and insulin resistance, is a definite forerunner of diabetes. More and more youngsters are diagnosed with type 2 diabetes, which poses a major health dilemma worldwide. Have either of your parents had a stroke or a heart attack prematurely in their 40s or early 50s? If so, it points to your genetic predisposition to develop hypertension, stroke, or any heart-related disease in your life. What was your birth weight? Babies born with a very low birth weight of less than 2.5 kilograms have a greater chance of an increased destructive metabolic cycle later in life. Often these children start to gain fat around the waistline by the age of 6 to 8 years, and this continues as they become teenagers and even into adulthood. Their risk to develop diabetes during pregnancy, type 2 diabetes, or liver disease in adult life is increased dramatically. How old are you? If you are over 40, you are more prone to develop diabetes and cardiovascular disease. Aging is a natural process linked to the destructive metabolic cycle of oxidative stress and inflammation. You cannot do anything about your genetic makeup or birth weight. Neither can you prevent aging. However, the insight into your susceptibility gives you more reason to follow the suggested lifestyle changes, as outlined in Part 2, in order to maintain optimum health and prevent any deterioration in your health. When you have elevated blood sugar levels, central obesity, take blood pressure tablets, as well as cholesterol-lowering medication, then you have the metabolic syndrome, previously referred to as the insulin resistance syndrome or syndrome X. Do you recognize any of the nagging symptoms of fluctuating blood sugar levels, such as excessive tiredness, unusual headaches, food cravings, or poor sleeping patterns that were mentioned in the previous section? It will be a good idea to have your fasting blood sugar tested. An elevated blood sugar level directly potentiates the destructive metabolic cycle. In the long run, this can damage the arteries and increase blood clot formation. Has your blood pressure always been normal, or even very low, and now creeping up year after year? Do you take any blood pressure medication? The destructive metabolic cycle can directly damage your blood vessels by causing abnormal thickening of the walls, resulting in high blood pressure. Excessive insulin in the blood due to insulin resistance also causes sodium retention, which elevates your blood pressure and can leave you with water retention in your hands and feet. Do you know what your cholesterol level is? We all know that a high cholesterol level in your blood is associated with an increased risk of coronary heart disease. However, did you know that even if your cholesterol is within the normal range, you might still be at risk of coronary heart disease? To assess this risk, you must always have a lipogram done, which measures the triglycerides, as well as the HDL, or good cholesterol, and the LDL, or bad cholesterol. According to the International Diabetes Federation, you need the following measurements for the diagnosis of the metabolic syndrome: your waistline in centimeters, your blood pressure, a fasting blood glucose test, and a lipogram for your cholesterol. Blood tests should be done early in the morning following a fast of at least 8 hours. Only water is allowed, but no food, coffee, or tea. To be defined as having the metabolic syndrome, you must have 3 of the following: a waistline of more than a maximum of 88 centimeters for women or 102 centimeters for men. Raised triglycerides equal to or more than 1.7 millimoles. Reduced HDL cholesterol. In women, less than 1.3 millimoles, and in men, less than 1 millimole per liter, or any treatment for cholesterol. Raised blood pressure with a systolic pressure equal to or higher than 130, or a diastolic pressure equal to or higher than 85, or blood pressure medication taken. Raised fasting glucose levels higher than 5.6 millimoles per liter. Let's look at Jane. She complains about a number of nagging symptoms due to her hectic rat race lifestyle, such as excessive tiredness during the day, poor sleeping, and intense cravings. Her waistline measures 78 centimeters, which is fine. Her blood pressure is 120/80, which is normal. Her fasting blood glucose is 6.5 millimoles per liter, which is higher than the allowed 5.6. Her HDL is only 0.8 millimoles per liter, which is far less than the suggested 1.3. Her triglyceride level is 2.8 millimoles per liter, above the allowed 1.7. Jane scores 3 out of 5, and therefore has the metabolic syndrome. There is something fundamentally wrong with her health or lifestyle, as these conditions have an additive effect. She is at high risk of developing type 2 diabetes and coronary heart disease. John experiences a tremendous amount of stress at work and is an adrenaline addict. He has a waistline of 110, so he has central obesity. He is taking medication for his blood pressure, and his fasting blood glucose is 6.6 millimoles per liter. Although his cholesterol levels are perfectly normal, he also has the metabolic syndrome. He is, therefore, prone to developing diabetes, heart disease, or cancer. If he already has diabetes, his chance of developing heart disease is exceptionally high. Have you noticed an increased waistline lately and recognized a number of nagging symptoms, but still you don't fit the criteria for the metabolic syndrome? The traditional existing markers do not account adequately for the increase in chronic diseases of lifestyle, such as heart disease, diabetes, or cancer. More and more markers are emerging as the actual consequences of the destructive metabolic cycle are better understood. Emerging indicators of risk include substances called adipokines, which are secreted by the fat cells from your new fat organ. The inflammation in your fat cells also triggers harmful substances that can be measured in your blood. C-reactive protein and serum ferritin are good indicators of the extent of the harmful low-grade chronic inflammation in your body. Emerging indicators of the tendency of your blood to clot include PI1 or plasminogen activator inhibitor 1, as well as fibrinogen. Homocysteine is an amino acid in the blood. Too much homocysteine in the blood is related to a higher risk of coronary heart disease and stroke. A variety of additional abnormalities and conditions are, therefore, associated with the destructive metabolic cycle of free radical formation, oxidative stress, inflammation, and insulin resistance. Do you want some good news for a change? You have the power within yourself to modify your lifestyle easily according to the strategies and simple guidelines in Part 2. These changes in your eating pattern and way of living will protect you from further consequences of the destructive metabolic cycle or reverse some of the damage that has already occurred.